Hello dear students, we are here before you to present oral pathology lectures. These are very easy topics which is very basic and very easy to understand. If you have understood these topics, it will be very easy for you to go through your clinical aspects because you have to judge each and every disease, its aspects, its approach, its clinical treatment. Based on this knowledge, you have to go with the differential diagnosis, and with these investigations, you can reach to final diagnosis. Treatment plan will be proper only if you diagnose a disease at the initial stages. So mere diagnosis will not help. After diagnosis, you have to go with the treatment plan. Here in today's lecture, we will discuss basic disorders of the tooth. In the tooth, we have pulp. When it is inflamed, it is called pulpitis. So, initiation of the pulpal disorders or initiation of disorders in the tooth will start from pulp. So, how does that pulp is affected? There is an initiation of caries. Caries is the main reason. Other is trauma, but most of the cases, caries is the most etiologic factor or irritating factor to the pulp. So in today's lecture, we'll be discussing about all the pulpal disorders and the diseases uh, involving the periapical tissues. So our first topic for today is acute pulpitis. As the name suggests, itis means inflammation. And it's an acute condition. The why I'm discussing its title only because there is an inflammation in the pulp which is of acute pattern. The condition is acute in a body, all the pain, all the symptoms will be of severe level. So now they are giving it as a definition. First of all, it is an irreversible condition. All the symptoms are acute and intense, and inflammatory reaction is very severe, and obviously, as the name suggests, it is inside the pulp. Okay, so in this way, we can go with the definition of this acute pulpitis also. It's an acute inflammatory reaction of pulp. Okay, other definition what you can write: acute inflammatory reaction of pulp. If you have forgotten the definition, leaving blank is not a good thing. If you have forgotten, you will write this. Okay, now it's an irreversible condition. So you will write here acute irreversible inflammation of pulp. Short and sweet definition. Now etiology. So as I mentioned in the lecture few minutes ago, its etiology is basically due to caries. Okay, so this is the main factor. Sometimes during the cavity preparation in clinic by dentist, this is called iatrogenic. Dentist does not wish to injure or irritate the pulp, but due to some reason, the pulp gets inflamed or irritated, and this is called iatrogenic error. So sometimes pulp will be exposed due to faulty cavity preparation. Okay, the first one is caries, second is iatrogenic, third is chemical irritation to pulp. Okay, in this reason, in these cases, some chemicals are there which on taking there will be problem in the pulp. For example, too hot or cold food, citric fruit, some materials are there which are placed in the teeth and they will have chemical effect to pulp. Other etiology is cracked tooth syndrome. It is fractured tooth or tooth is cracked. Restoration is given without proper thermal insulation. So what does it mean? For example, this is a tooth and pulp is here. So when you give restoration, if it is close to the pulp, you have to place base as well as liner over the pulp. Okay, base or liner over pulp is to be placed to protect the pulp. Now if we don't apply this base or liner and just give the restoration, okay, then there are chances that heat will transfer. So due to improper thermal insulation, there are chances of irritation to pulp. Then blow to the tooth with subsequent damage to the pulp. This is a sort of trauma only. Carries once again around the pre-existing restoration. Then galvanism. For example, in your cavity, in your oral cavity, one tooth is there which is having amalgam restoration. Other tooth is there which is having other metal restoration. So different metals will have galvanism, exchange of ions will be there, and due to this there are chances that pulpitis will be there. ठीक है, तो ये आपको रटने का नहीं है, जैसे मैंने बताया कैरीज, फिर आप बोल सकते हो रिकरेंट कैरीज, ट्रॉमा आएगा, क्रैक्ड टूथ आएगा, ट्रीटमेंट के टाइम कोई पल्प को इंजरी आ गई, इम्प्रॉपर आपने ट्रीटमेंट करी हो, पल्प को प्रोटेक्ट नहीं किया हो, ऐसे बहुत सारे आप पॉइंट्स लिख सकते हो. ठीक है, रटने का नहीं कि ये 10 दिए तो मुझे एग्जाम में 10 ही लिखना है. अगर आप 3 या 4 लिख दोगे तो भी चल जाएगा. ठीक है, अब आता है हिस्टोपैथोलॉजी. तो क्या है हिस्टोपैथोलॉजी? तो जैसे कि इन्फ्लेमेशन में क्या क्या होता है वही आपको लिखना है, क्योंकि ये है इन्फ्लेमेशन ऑफ पल्प. तो इन्फ्लेमेशन में क्या हो जाएगा? पहले तो वासोडाइलेटेशन होगा, ठीक है, इडिमा भी हो जाएगा, और ये आपको मैंने बता दिया था इन्फिल्ट्रेशन आ जाएगा पीएमएनएस का. इन्फ्लेमेटरी कनेक्टिव टिश्यू में इन्फ्लेमेशन वाले सेल्स आ जाएंगे, और कभी कभार ओडोंटोब्लास्ट जो सेल्स होंगे वो कभी कभार डैमेज भी हो सकता है, पल्प डेंटिन बॉर्डर होगी वहां पे. ये हिस्टोपैथोलॉजी में खाली आपको इन्फ्लेमेशन वाली चीज लिखनी है और कंप्लीट डिस्ट्रक्शन ऑफ ओडोंटोब्लास्ट सेल्स लिखना है. तो यहाँ पे जहां भी हिस्टोपैथोलॉजी आती है वहां पे आपको डायग्राम इज ए मस्ट. तो ये सारे पॉइंट्स आपको डायग्राम ड्रॉ करके बता देने हैं. ठीक है, और उसके बाद हिस्टोपैथोलॉजी में ही माइक्रो एब्सेस भी हो सकता है पल्प के अंदर, कभी कभार लिक्विफेक्शन डीजनरेशन भी होगा. ठीक है, और ओडोंटोब्लास्टिक सेल लेयर अभी हमने जो थोड़ी देर पढ़ा ना, वो भी कभी कभार खराब हो सकता है, और इस कंडीशन को बोलते हैं एक्यूट सपोरेटिव पल्पाइटिस. ठीक है, जब एक्यूट कंडीशन हो और पस भी फॉर्म हो जाता है, ओडोंटोब्लास्ट सेल लेयर डैमेज हो जाता है, उस कंडीशन को बोलते हैं एक्यूट सपोरेटिव पल्पाइटिस. ठीक है, लास्ट में पल्प का डेथ हो जाएगा क्योंकि टिश्यू को प्रॉपर न्यूट्रिशन नहीं मिलेगा, वो डिहाइड्रेशन हो जाएगा, और जब ऐसा होता है इसको बोलते हैं ड्राई गैंग्रीन ऑफ पल्प. ठीक है, तो ये हिस्टोपैथोलॉजी में थोड़ा आपको याद रखना पड़ेगा. पहला पॉइंट है इन्फ्लेमेशन में वासोडाइलेटेशन, सेकंड है इडिमा, तीसरा है ओडोंटोब्लास्ट सेल लेयर डैमेज हो जाना, चौथा है ओडोंटोब्लास्ट सेल लेयर डैमेज हो जाएगा तो क्या हो जाएगा, वो लिक्विफेक्शन और नेक्रोसिस हो जाएगा पल्प का, क्रोनिक इन्फ्लेमेटरी सेल इन्फिल्ट्रेट हो जाएगा, उसको एक्यूट सपोरेटिव पल्पाइटिस बोलते हैं, और लास्ट में ड्राई गैंग्रीन हो जाएगा पल्प का. हिस्टोपैथोलॉजी में थोड़े 5-6 पॉइंट आपको लिखना है। यहाँ पे तो जो पैराग्राफ में दिया है उसको आप शॉर्ट शॉर्ट में भी लिख सकते हो डायग्राम ड्रॉ करके। अब क्लिनिकल फीचर्स, तो क्लिनिकल फीचर्स में क्या है, तो पेशेंट को जब खाना खाएगा तो व्हेन patient is consuming cold food or hot food, he will have tooth is sensitive. Then application of hot or cold stimuli increases the intensity to pain. Okay, pain बढ़ेगा cold or hot stimuli लेगा ना तब, and this pain will be present in the mouth even after the stimuli is removed. ठीक है, तो ये बहुत कुछ समझाता है। जब भी कोई हॉट या कोल्ड स्टिमुलाई आता है, at this point of time, if the pain is there, then even after the removal of hot or cold stimuli, if there is pain continuation or symptoms persist, then it is called irreversible pulpitis. Okay. और रिवर्सिबल पल्पाइटिस क्या है? Due to hot and cold stimuli, there will be pain or sensitivity to the patient. Once the stimuli is removed, those symptoms will go with the removal of the stimuli. The difference between reversible and irreversible pulpitis is persistence of symptoms even after the removal of stimuli in case of irreversible pulpitis. Okay. Now, pain increases during the sleep. Okay. During night time, pain increases because when the patient lies down on bed, there will be increase in local blood pressure in head and neck region. So due to this, patient will have more pain in the tooth during night. So night pain is a symptom of irreversible pulpitis. Okay, if the patient tells you that during night I had severe pain, then it will be an indication or suggestion of irreversible pulpitis. Now, entrance of pulp is not wide. Okay, for example, if there is a cavity in the tooth, so here only a slight decay will be there, which will be leading to pulp. So pulp cannot come out or infection cannot come out. Instead, they will spread to the periapical region. So acute pulpitis helps in the spread of inflammation throughout the pulp with subsequent necrosis. Why? Because its opening or the coronal portion is very narrow so that infection cannot move upward. Okay. Now acute pulpitis. Clinical feature. There will be micro abscess. Slight pulp will be formed in the pulp along with liquefaction degeneration. तो यहाँ पे आपको क्या सीखना है, जो हिस्टोपैथो में था वही ये लोग क्लिनिकल फीचर बता रहे हैं। ठीक है, और क्लिनिकल फीचर में हिस्टोपैथी, तो ऐसे आपको 3-4 चीजें याद रखना है जो आप पॉइंट आपके लिख सकते हो एग्जाम में। नाउ दिस पेन will be subsiding when the drainage is established. When you go with the proper drainage or when you create a proper hole in the pulp, all the pulp abscess will be shrinking due to the pus will be coming out. Okay. Tooth is non-tender to percussion. What is this? You have to percuss the teeth with the help of probe or mirror. When you go with probing the tooth, if the patient has severe pain, it is called tender on percussion. Okay. If the patient does not have features during tender on percussion, we can see that the pulp is not involved. Okay, so in the clinic nowadays, the first clinical testing is tender on percussion. We move the probe on the tooth or have the tenderness on percuss. Percuss the tooth. Percuss matlab you have to give pressure on the tooth with the help of this mirror or pulp. Okay. Now intrapulpal pressure becomes very high. At this time, it causes apical blood pressure vessels constriction और collapse. कनेक्टिव टिश्यू के अंदर क्या होता है, प्रेशर बढ़ जाता है, तब जाके ब्लड वेसल्स कोलैप्स हो जाएंगे, श्रिंक हो जाएगा, उसको बोलते हैं पल्प स्ट्रैंगुलेशन. ठीक है, तो ये जो क्वेश्चन है ना, वो आपको थोड़ा आराम से करना होगा, क्योंकि क्या होता है, आपको अगर एग्जाम में लिखना है तो हमने जैसे बताया आपको रटना नहीं है. पहली चीज तो ये है, आपको अपने हिसाब से अपने नोट्स में लिखना है. तो आप कैसे लिखोगे वो भी हम शॉर्ट में रिवाइज कर रहे हैं. देखो, सबसे पहली बात ये है कि जैसे कि क्वेश्चन आता है पल्पाइटिस का, ठीक है, तो आप क्या करोगे, पहले डेफिनेशन लिखोगे. डेफिनेशन में क्या आएगा, एक्यूट इरिवर्सिबल इन्फ्लेमेशन ऑफ पल्प. और ये पल्पाइटिस जो है ना, वो इरिवर्सिबल टाइप का ही पूछा है आपको, इसलिए यहाँ पे इरिवर्सिबल टाइप का डेफिनेशन है, acute irreversible inflammation of pulp. Now its etiology. Okay, then you can explain. First is caries, then improper cavity preparation, then restoration, faulty, then deep caries, then chemical, then iatrogenic, then fracture of tooth. So in this way you have to elaborate. Here you can see that I have not written in a paragraph. No paragraph is there. No grammar is there. Okay, so you have to remember this point. Okay, definition and etiology. Last is after etiology we have clinical feature or histopathology. Okay, so what you will do, you will draw diagram. In this diagram you will explain all the features. Inflammatory, cell, infiltrate, then hyperemia. Okay, here you will explain microabscess, then liquefaction, degeneration, then necrosis. Okay, whatever you draw inside, it is not a matter, but this labeling is important. In this way you have to mark all these point. Okay, understood? Now after histopathology, its clinical feature. So you will tell that intense pain on hot or cold stimuli. Okay, pain persists even after removal of the stimuli. Okay, Due to some error that has gone, we'll once again write this. Now in clinical feature, pain, okay, it is on hot or cold stimuli, it persists even after removal of stimuli, increased night pain. अब नाइट पेन क्यों होता है? ड्यू टू इंक्रीज्ड ब्लड सप्लाई और ब्लड प्रेशर इन हेड एंड नेक रीजन, ठीक है। फिर आपको बोलना है कि अगर पल्प के अंदर जो ओडोंटोब्लास्टिक लेयर है वो टूट जाता है तो एब्सेस भी हो सकता है। एब्सेस इतना ज्यादा होगा तो वो डीजनरेशन भी होगा, लिक्विफेक्शन, फिर नेक्रोसिस भी हो जाएगा। और एब्सेस इतना अच्छा होगा कि वो ब्लड वेसल्स को कोलैप्स कर देगा, इसको बोलते हैं पल्प स्ट्रैंगुलेशन। तो ऐसे पॉइंट्स आपको लिखने होंगे, यही आपको एग्जाम में लिखना है, पैराग्राफ में नहीं लिखना है, ठीक है। अब आता है ट्रीटमेंट, ठीक है। तो ट्रीटमेंट तो थोड़ा भी आपको समझा देते हैं। व्हाट इज इट्स ट्रीटमेंट? इन दिस केस removal of etiology is the treatment. Whatever is the etiology, for example, there is a faulty restoration, you have to remove that first. If there is sensitivity to the tooth due to the loss of tooth structure, you have to protect it from desensitizers. You have to remove the etiology first and then go for proper restoration. If the pulp is very necrotic, you have to go for pulp removal and then go for RCT. Okay, in RCT we remove all the necrotic or damaged pulp, then refill or replace the pulp with gatta parcha. Okay, this is all its treatment. If only the coronal pulp is involved, then we can go for some symptomatic measures like pulp capping, pulpotomy, ठीक है, apexification, apexogenesis, all this will be discussing in the upcoming lectures. Okay, so this is treatment for pulpitis. Now we move ahead. The second question, different causes of pulpitis we have already discussed. Clinical features we have already discussed. Histopathological features of chronic open hyperplastic pulpitis we have discussed, but that was of acute irreversible. This is chronic and hyperplastic, so this is called pulp polyp. This question you are seeing on the screen, in short, it is a question answer of pulp polyp. Okay, so now when you already knowing acute reversible irreversible pulpitis, this question will be easy for you to answer. Pulpitis means inflammation of dental pulp within the tooth. Okay, as I told you, causes of pulpitis, so we have already discussed. In reversible, we have only some agent which are able to disturb the pulp, okay, like trauma, disturb relationship and thermal shock. But in this case, reversible, after removal of stimuli, pain will be going. But in case of irreversible, this pain will persist even after the removal of stimuli. Its causes are carries chemical, thermal, mechanical injury. Okay. Now acute pulpitis and chronic pulpitis. There are two types. We already discussed acute, those are reversible and irreversible. Here we'll be discussing chronic pulpitis. In chronic pulpitis, we'll be discussing chronic open hyperplastic pulpitis or pulp polyp. The first sentence only they are telling that other names. It is called pulp polyp or pulpitis aperta. Now it's a productive pulpal inflammation. Okay, why does it happen? It's a inflammation due to extensive carious exposure of young pulp. Pulp is very young, but caries is too extensive. Due to that, it will overtake or damage the pulp to that extent that it will lead to pulp polyp. Now, in pulp polyp, due to the severe extension, granulation tissue will be formed. In irreversible pulpitis, we did not see anything or any sentence about granulation tissue. But in case of chronic hyperplastic tissue, we find granulation tissue. Okay. So in this way, you have to differentiate. Okay. For example, reversible pulpitis, irreversible pulpitis, and pulp polyp. Okay. First is definition, etiology. Clinical feature and histopathological feature only will be different. Rest will be same. In case of definition, it's a reversible condition. It's an irreversible and it's a chronic condition which is characterized by polyp or pulpal tissue in the crown. Etiology is same, mechanical, thermal, carious, fracture, all these are the etiology. Clinical features that are different. Pain will go, here pain will persist, and here sometimes pain will be there or pain will be no there. Okay. Histopathological features will be somewhat different. Here only hyperemia will be there. Inflammatory cell infiltration will not be there. Abscess will not be there. Necrosis not will be there. Degeneration will not be there. Here everything will be there, but of acute condition. Here everything will be there, but of chronic condition. Okay. In this way, you have to differentiate and add your points. So clinical features. Pulp or gingiva will be there in the cavity. In the cavity of tooth, there will be pink, red or lobulated mass. In the cavity, carious cavity, there will be pink or red mass. Okay, you will think that gum has grown inside the tooth. Now they will be seen in young adults. So here you have to just write age. So in adults and children. Site, this is deciduous molar and first permanent molar. Then affected tooth. Carious cavity will be open, which is present for long duration. Then increased bleeding on provocation or on touching that mass. No pain will be there. Sensitive to thermal stimuli. It will be sensitive only to thermal stimuli, not to cold stimuli. Now histopathology. Draw a diagram and whatever we have discussed in this irreversible pulpitis, you have to go with the chronic inflammation feature. Okay, in chronic feature, we have granulation tissue. Okay, in granulation tissue, always, anywhere when you find granulation tissue, there will be fibroblast and blood capillaries. Okay. तो फर्स्ट सेंटेंस इज ऑफ ग्रेनुलेशन टिश्यू, second is of inflammatory cell infiltration, third is which epithelium will be found, stratified squamous epithelium will be there, then well formed retapex will be there, retapex will be predominant or well formed, then desquamated epithelial cells. So all these points you have to write in your diagram as I explain you how to write. Draw a diagram. First you write granulation tissue, then retapex are well formed, then inflammatory cell infiltrate, stratified squamous epithelium, desquamated cells. So in this way you have to draw the diagram and write in your exam. Now once again short note on pulpitis, chronic pulpitis. Okay, the same thing you have to write. What people do is create a basic knowledge of all these pulpitis, acute, chronic. How? You have to present in tabular form. As I told you, what you will do, you will write in this form. Have all the three in a line. Write the difference, definition, etiology, clinical features, age, treatment. In this way, you will be able to write easily 5 marks question. You do not mug up here. In oral pathology, it is like if you are having fever, what are the symptoms? So you do not mug up. You write lethargy, tiredness, high grade fever, lack of appetite. All these points you will write. Okay, the same way you have to make few points which are directly correlating to that disease. Okay, for example, irreversible pulpitis is there. So I mentioned you that pain will be constant even after the removal of stimuli, and night pain will be there. So if these are the feature, directly it should be coming to your mind that this is a problem of irreversible pulpitis. In chronic pulpitis, we don't have pain as a symptom. Only in the severe stages, or if there is an acute exacerbation of this pulpitis, then only we will be having pain. Now, chronic pulpitis. It's a condition characterized by low grade fever. Okay, fever will be low grade. Inflammatory reaction will be there, and symptoms will be very less. It's a chronic condition. So, etiology, we did not now go to this point because, as I mentioned, caries will be there, restoration will be there, mechanical problem will be there, thermal problem will be there, chemical problems will be there, iatrogenic problems will be there. All are the etiology. Okay. Now, clinical feature. The tooth will be asymptomatic, dull pain will be there, throbbing pain will be there, less sensitivity will be there to hot and cold stimuli. If electric pulp tester, what happens? If method to check that if the tooth is non-vital or vital, tooथ जिंदा है या मर गया है, उसके लिए हम इलेक्ट्रिक पल्प टेस्टर से हम टेस्ट करते हैं. फिर we will be checking whether it is vital or non-vital. In this case, if electric pulp tester is used in chronic pulpitis, it will be responding to a higher level of current. Now, sometimes जो पल्प टिश्यू एक्सपोज हो गया है उसको आप टच कर सकते हो, उसको निकाल भी सकते हो, लेकिन ब्लीडिंग एक्सेस होगा उसके अंदर. ठीक है. हिस्टोपैथोलॉजी. वो तो आपको अभी याद करने की जरूरत ही नहीं, डायग्राम ड्रॉ करके। इन्फ्लेमेशन, ग्रेनुलेशन टिश्यू क्रॉनिक है इसलिए, इरिवर्सिबल में ग्रेनुलेशन नहीं आएगा, ठीक है। क्रॉनिक है इसलिए ग्रेनुलर ग्रेनुलेशन टिश्यू आएगा, उसके अंदर फाइब्रोब्लास्ट आएगा, ब्लड वेसल्स आएगा, इन्फ्लेमेटरी सेल इन्फिल्ट्रेशन आएगा, ठीक है। फिर अगर ज्यादा इन्फ्लेमेशन हो गया तो फाइब्रोब्लास्टिक, जैसे मैंने बताया ना, फाइब्रोब्लास्टिक हो सकता है और कभी कभार इंटरनल रिसॉर्प्शन भी होगा। ब्लड कैपिलरीज ज्यादा होगी। ग्रेनुलेशन टिश्यू का दो फीचर इंपॉर्टेंट है, आपको कहीं भी ग्रेनुलेशन टिश्यू पूछा जाए तो एक तो फाइब्रोसिस होगा, फाइब्रोब्लास्टिक एक्टिविटी, और ब्लड कैपिलरीज या ब्लड का फॉर्मेशन, ब्लड कैपिलरीज ज्यादा बनेगी, ठीक है। और कभी कभार ज्यादातर केस में कैल्सिफिकेशन भी देखने को मिलेगा क्रॉनिक पल्पाइटिस, ठीक है। अब ट्रीटमेंट, ट्रीटमेंट क्या आएगा, तो रिमूवल ऑफ इटियोलॉजी, ठीक है। फिर नीचे का जो पल्प है जिंजाइवल टिश्यू, उसको आप कट कर सकते हो। फिर पेशेंट को अगर टूथ बचाना है और आपको भी बचाना है तो आप रूट कैनाल थेरेपी भी कर सकते हो। अगर पेशेंट को मूड नहीं कि नहीं बचाना है तब जाके एक्सट्रैक्शन करना है। ये थोड़ा सीक्वेंस उल्टा है, पहले हमको आरसीटी करनी चाहिए, फिर पेशेंट नहीं मानता है तब जाके हमको रूट कैनाल थेरेपी करनी होगी, ठीक है। तो आज के लेक्चर में इतना काफी है गाइस। हमने जो आपको पढ़ाया है वो पढ़ाया है डिसीज ऑफ पल्प इनिशियली, बाकी के टॉपिक्स अभी बाकी हैं। तो पल्पाइटिस का भी कोई भी क्वेश्चन आए आपको इजीली लिखना आना चाहिए। एक्यूट रिवर्सिबल पल्पाइटिस, एक्यूट इरिवर्सिबल पल्पाइटिस, क्रोनिक हाइपरप्लास्टिक पल्पाइटिस, आगे के जो टॉपिक्स है वो हम नेक्स्ट लेक्चर में पढ़ाएंगे। तो गाइज हमारे चैनल को लाइक कीजिए, सब्सक्राइब कीजिए, और अगर आपने हमारे चैनल को सब्सक्राइब नहीं किया तो कर लीजिए, बेल बटन भी दबा दीजिए ताकि आपको नोटिफिकेशंस मिल सके अपकमिंग वीडियोस के। Please share our videos to all your colleagues because we will help you to pass all the years of BDS. These videos will be helpful for passing you in all the dental exams. We don't have any copyright. You can share these videos and you can also give guidance to your colleagues as well as juniors. Guys, it is time for telling you bye bye. Have a nice time. Bye bye.